So actually, this is the last topic for infectious diseases. Is my audio clear?
Yes, no.
So this one, can you hear me? I just removed my earphone.
Yes, po, Doc. Okay, Doc.
So clear pa rin ah.
Yes, Doc.
So our lecture for today is just a short lecture on basic control, basic infection control. So I think this will not get a lot of your time for lunch. Okay. So probably we'll finish this topic before 1 o'clock. So you tell me if we can just start the topic. So we have 81 already, 81 participants. Okay, so we can start. So actually, the topic for this afternoon is more of the application and how do we prevent and control uh, the infections, especially the ones that I discussed to you before, the important organisms, how they will transmit, how will they cause infectious diseases, how do we control, how do we handle, in such cases that if you encounter in the clinics or in the community. So this basic infection prevention control is the last topic that actually we plan to give to you in order for you to know what are our goals, okay, in handling infectious diseases. Okay, so basically our goal, just put it in your mind that our goals are the following. So we need to protect, number one, our patients. We protect ourselves. We protect our fellow health workers. We protect our visitors. Okay? We protect our environment. And especially we protect our loved ones. So what you need to know about infection control. Okay. So just be considerate in terms of our responsibility. Okay. So we have a big role to play, especially uh, if the community is actually involved already. So we should have at least a clear understanding of what is our role, especially in preventing the spread of infection. Okay? So some of us or most of us should know at least the familiarity of the policies as well as the guidelines, okay, as well as the procedures that actually help us in our day-to-day work. Okay, so we undergo training, we undergo seminars, we undergo meetings. Okay, we undergo these lectures that actually broaden our mind and help us understand its procedure. Okay, so as a healthcare worker, okay, so we are the ones who are leading, especially doing policies and doing guidelines. We are responsible for our health education, not only to our patients, not only to our friends, but also in our community. Okay, so if they give you something, for example, a machine, or they give you a medicine, so as a caregiver or as a healthcare worker, so we need to read first before sharing it to others. So what does it mean? Okay. So see to it that every products, okay, every procedures that you will do, okay, you need to weigh its pros and cons. For example, there's a new drug that came in the community or new drug specifically, for example, for the COVID-19. You try to see first what are the studies that are involved. What do you think are the risks that the patient may have? What are the common adverse effects? What are the potential life-threatening effect on that drug or the procedure that you will do on the patient? Okay. So just to remind you, okay, handling infectious diseases are actually very dangerous. Okay. So that's why we are the ones who will evaluate, okay, we improve, okay, through what? Okay, through our researches, through our literature review, and for our data and the analyze. Okay, so that is our role as a healthcare workers. Okay, so for the basic ones, okay, like for example, our basic infection protocols, principles. Okay, so number one is the hand washing. Okay, so they call it now as a hand hygiene. Okay, this is the most fundamental infection prevention procedure. Okay, the other thing, cleaning is necessary for the first step before sterilization. Prevention of sharps. Okay, reducing exposure of risk. Okay, do you know whom and what are treating? Okay, do you disinfect or do not disinfect when you can sterilize? Okay, So what are the things that you should come into your mind, okay, with regards to infection? So in one way, just remember the chain of infection. Okay, I think I discussed to you before the chain of infection. Okay, so what is this? Okay, so remember it's cycle. Okay, if the parasite has its life cycle, we have this kind of cycle also, especially in hunting chain of infection. So remember from the reservoir, from the portal of entry, from its mode of transmission, and another portal of entry, susceptible host, and then how it become an infectious agent. Okay, so we tackle most of the bacteria, viruses, fungi, protozoans, the parasites. We discussed about the reservoir. Okay, we discussed the mode of transmission. Okay, so what will happen? Okay, this is our role. Okay, for the chain of infection, we cut. Okay, the chain of infection. So we prevent if, for example, the infectious agent has its portal of entry already. So we are the ones who are actually up on the susceptible host. Okay, it's either we do necessary physical history of the patient, we do a physical examination, we do the diagnostic tests, and then after we give necessary treatment just to cut, okay, just to destroy these infectious agents. Okay. So from there, for example, in the reservoir, okay. So what are the things that we should do? Okay. Why? What are the things that we need to prevent? Okay. Especially if, for example, there's already some portal of exits like excretion, droplets. So what are we doing now? For example, is COVID-19 spread. So what we usually do, the basic ones, we use, okay, face mask, we wash our hands, we do the vaccines, okay? We do everything in order to prevent this transmission, okay? Especially on the entry of the susceptible host, okay? So this is important for us. We need to break the chain of infection, okay? So from its reservoir, so we have what we call the standard precautions. We have the vaccination, sterilization. We do the hand hygiene. We do the instrument management. Okay, this is important for us, especially we are clinicians. Okay, so we are the surgeons, we are the clinicians, we are the educators. At least we will know how to guide our patients, our community members, as well as our friends and our loved ones. Okay? So, like for example, this hand washing. So remember our hand washing. Okay, so there are a lot of areas for which the organisms can attach to. Okay, so as you can see on the slide, okay, so there are a lot of things. Okay, that we need to uh, know about its hand washing. Okay, so that's why as a doctor, okay, as a healthcare worker, we need to know the principle of the hand washing. Okay, I think later I'll just give you a slide on hand washing. Okay, so this is the one. Okay, so remember the Department of Health is actually advertising how to do the hand hygiene technique. It's a proper way of doing hand hygiene technique. Okay, so when I was a resident and also a medical officer in Singapore, before you do or you handle patient, okay, you need to pass the hand hygiene technique. Okay, so what is the proper way of doing the hand hygiene technique? This is very important for us. Also, it's very important in other. Okay, so I think that last time, I think they implemented already that before, okay, you go to a clinic or you go to the hospital, okay, they will ask you to perform the hand hygiene technique. So as a third year medical student going to fourth year medical, you go for clerkship already. So at least the basic thing that you will know is the hand hygiene. Okay, so they will check and they will advise you to memorize. Okay, so remember if they ask you the exam, still the most important measure for preventing infection is the hand hygiene or hand washing. Okay, so in other areas, for example, this COVID-19, okay, we have what we call ways how to put our personal protective equipment. Okay, they call it the PPE. Okay, personal protective equipment. Okay, so in terms of hierarchy of control, this is the last one. Okay, so we have the engineering, we have the administrative, and then we have the personal protective equipment. Okay, so engineering control. Okay, so from our uh, the structure itself, if we have a negative pressure, and then if we have this, what we call the administrative, is for example, we do some flyers, okay, flyers or commercial ads regarding the infectious diseases, how to prevent, how to control. So what is this? What is that? Okay. The next, which is the last, is uh, the personal protective equipment. Okay, so I've said, for example, we have uh, this COVID-19 now. Okay, so we have non-COVID versus COVID isolation areas. So before going to a COVID isolation area, so we need to do the proper donning as well as doffing. Okay, so from donning, okay, so we have these steps from the gown, with the mask, okay, have the goggles or face shields, or the gloves, comparing it in sequence in removing. Okay, so if we do the donning, so we put the gown, we put the mask, we put the goggles or face shields, we put on the gloves. Okay, and the sequence of removing the PPEs from the gloves to the face to the mask and lastly to the gown. But if you go specifically in the COVID isolation area, you have a poster there that you can follow. Okay, but if you are used to it, okay, it's very easy to put the personal protective equipment. Okay, so your gear. Okay, so we always mention about the universal protection. Okay, which is actually a very good principle. Okay, so all infected patients cannot identify on the basis of the medical history, physical examination, and laboratory examination. Hence, the philosophy is to consider all patients to be infected with pathogenic organisms. So hence, it is recommended that the basis, certain basis infection control procedure must be followed routinely for all patients. We call it as universal protection. Okay. So I keep on repeating. Okay, so for example, if you're a dentist, if you're a surgeon, okay, this is very important general principles, okay, of infection control. So we need to identify what are the high risks, the source of infection, universal protection. You need to protect environmental contamination, use of sharps, okay, handling biopsies, okay, infection control during radiography, biochemical waste, okay, so etc. Okay, so the personal protective equipment, okay, for example, make available hepatitis B vaccination to all, okay, make available post-exposure evaluation, use of label signs to communicate hazards, okay, maintain worker, medical, and training records. So actually, this one is just a general uh, principles, okay, that we need to know for basic infection control. Okay, so I think this is the last one. Okay, so I think for you guys, okay, okay. So can you open your cameras, please? Okay. So I just keep on repeating the principles. Okay. So these are the basic things that you need to know. Okay. So once you go in clerkship, hopefully by next year, okay. So the only thing that you need to focus, okay, is how to handle infectious procedures, infectious diseases, for example, especially those who are transmitted by droplet or by anything. Okay, so always wash your hands, wear face mask. Okay, uh, wear your gowns, especially if you're doing procedure, and especially your face shields. Okay, so especially now that actually uh, there's a new variant for COVID-19. Okay, what is the principle behind for this COVID-19? Okay, so what are the things that we need to do? For example, okay, as a prevention for infection control. Okay, first, okay, number one, is you would need to protect yourself. Okay, so what are the things that you need to protect? Is so what are the things that you need to do? Okay, so as a healthcare worker, okay, you should have your own nutrition requirements. Okay, your vitamins. Okay, this is the ones that I usually emphasize. Okay, so even what body type that you have, okay, if you don't take care of yourself, okay, the more the COVID-19 will affect you. For example, uh, in our setting in this hospital, okay, so the things that I usually see or the patients that I usually have are those employees or actually those who are dieting. Okay? So, yung mga nagpapapayat, those who are on diets, okay, they usually are the ones who have the infection. Okay, why? Because you limit the normal nutritional requirement, okay, on your body. Okay, there's some who are not taking vitamins. There's some who are actually not eating during the time of meals. Okay, this is one factor that can acquire this COVID-19 may be affected. Okay. Secondly, is the use of the face mask. Okay, so initially, okay, we used the cloth. Okay, but now better as a healthcare physician, a healthcare practitioner, we use the N95 as one of our protection. If you don't have N95, if you have the surgical mask, you can have two, okay, two surgical masks, okay, or you can use some KN95, or you, the thing that they usually tell us now is use double mask, okay. Then aside from that, always do hand washing, okay. So once you go for clerkship, okay, after you finish your work, you always take a bath and you go home and take a bath again. Okay, that's one of the protection that you will need to do. Okay, and then syempre, if you go for COVID isolation, you need to follow the steps on how to done and how to go. Okay. Aside from that, always need to update yourselves with the common or the updates on COVID-19. Or let's just say in general infectious disease. Okay. So just one of advice, okay, once you go for clerkship, if you do not know the procedure, if you do not know, okay, what to do, always ask. Okay. If you go on clerkship already.
Okay, but since uh, you'll be finishing already your infectious diseases, I hope you got a lot of ideas, especially the must knows that you will encounter in the hospital. Okay, so this topic, infectious diseases, are actually interesting. Okay, especially this will be your bread and butter. Okay, in the hospital. Okay, so even you go for pediatrics, surgery, internal medicine, you always remember the infectious diseases. Okay, subject. Okay, so before we end for your topic, our topic for this semester, okay, do you have any questions? Do you have any clarifications? Okay, if you want to ask the exam actually it's very easy. Okay, so I made it easy for you. Okay, so just remember the must knows. Okay, and should be less. Some will be need to know. Okay, but this one, because IDS, the organisms keep on changing. So from one antibiotics to another. Okay, so just remember. Okay, always do your complete uh, history. Okay, and physical examination. Okay, so 80% if you focus on that, uh, if you focus on physical and the history of the patient, so makukuha mo na, you will get the diagnosis around 80 to 90% already. Okay, so are there any questions? Okay, did you learn anything? Okay, so you have question here. Okay, so actually, okay, uh, especially you're in a medical field. Okay. Ideally, it's better for us to do face to face. Why? Okay, because this is very important for us, especially if you're handling a case already. So I have noticed, just to tell you, with regards to the clerks last year who have done the face to face, or 2 years ago. Okay. Once they came with us, for example, for residency, okay, there are a lot of things that they need to do. Okay. Number one, for example, doing NGT insertions, doing insertions of the IV. Okay. So your question with regards to is it safe? Okay. Is it safe to have face to face? The question there is, are you doing well? Okay, are you doing your proper protection for your own? Okay. So what are the things that you need to do? Okay. Number one, your vaccinations. Okay, vaccinations, your booster shots, the use of your face mask, and face shields in the hospital, handling patients. Okay, just to tell you this one. Okay, we are actually 40 consultants in ITRMC, the internal medicine. Okay, remember that we are 40. And then what is our statistics for the COVID-19 infection? Okay, so we are only 8 remaining consultants that actually don't have COVID-19. Okay, so if you analyze, okay, so anyone can be affected by COVID-19. But as long as you're doing the proper principle, proper infection control, or proper prevention, you have less risk, okay, of having infection. So if you ask me if it's okay to have face to face, is it safe? Actually, we cannot say if it is really safe. But if you are doing the proper protection or proper infection control, then probably this is good for you guys to do face to face. Okay, so you learn better. Okay, if you see patients rather than doing face to face, rather than doing in a Zoom meeting, and then they will just show you how to do the examination, how to do the proper physical history. Then you just do on the in front of the computer. Then best to have face to face. Okay, that's the one that I advise. Even you know a lot of theories, okay, but once you are there already, the battlefield, it's difficult. Okay, so I must say, okay, as of experience, it's better still to have face to face. Okay, if you ask me. So same, also with the vehicle, etc., etc. As long as you're wearing, okay, your your protection, okay, then probably you will not be at loss. Okay, okay. There's a difference between going to the hospital or going into the school. Okay, okay. So actually, okay, if we achieve the herd immunity, I think sending the patient or sending your loved ones or your brothers and sisters to high school is actually okay. As long as still we emphasize to them the use of the proper protection. Okay, since now that they decreased already the age limit, okay, for the vaccine or the start around 12 years old and above, then we do the vaccination. Then probably it's a lot safer for them to go for high school already for face to face. Okay, so for this Omicron variant, okay, just to tell you with this one, actually there's less study yet on Omicron because it just came up for I think 1 month ago or less. Okay, so they only find out okay that this Omicron that was infected was unvaccinated. Okay, I think that's the one in Hong Kong is unvaccinated. I think in I don't know if it's in South Africa if it is partially vaccinated or not. Okay, so they still we still need to find what is this Omicron. They say this is twice faster than Delta, and this Omicron is the one that predisposes more for those patients who have COVID 19 already before. Or this Omicron has what we call anti-vaccination property. So we still need to find out. Okay, so as for us, we still go for our prevention. Okay, so not to worry about the Omicron yet, as long as we are wearing our protective equipment. Okay, so are there any other questions? So so I hope that all of you will pass. Okay, on general medicine. Okay, so I think I think okay I think okay my subject will pull you up. Okay, so you need to concentrate, especially on the final exam, especially those who are hanging. Okay, you can concentrate. Okay, especially on my topic. Cover to cover, yes. Okay, cover to cover, yes, but still the must knows. Okay, so very easy. Okay, very easy. Okay, so you can read on my slides. You can add on. Okay. Remember that the exams that I gave you before is the same pattern. It's purely multiple choice. Okay. So do you have other questions? No more? So I'm checking your attendance. Huh? So those who are not around, okay, and then your scores are actually low. Okay. So I don't know. It will be we will decide. Okay. So if you're not attending our meetings, our topic lectures, okay, and then we see that your grades are hanging, then we will discuss. Okay. So I hope you are all present from all our topics. Okay. So any questions before we end the day? So I think your exam will be next week, December 7th. Okay, so good luck and I'll see you in clerkship. Okay? So yeah. So we can end the day and God bless to all. Okay, thank you.
Thank you, Pag.